Welcome to the Manalapan Englishtown Annual Employee Training. Today we will be discussing asthma, epilepsy, diabetes, and life-threatening allergic reactions requiring emergency auto-injector epinephrine. This was created and presented by Kelly O'Keefe and Maria Malazzo.
The purpose of this presentation is to comply with the DOE Health Services Policy and Procedural Requirement, to assist staff in recognizing medical emergencies as it relates to asthma, diabetes, seizure disorder, and anaphylaxis, to obtain rapid medical response to the student who has a medical emergency, to remind staff to refer to the general first aid guidelines provided each year by the school nurse in collaboration with the school physician, and to remind staff of the location of the AED, automated external defibrillator, and spare epinephrine.
These are the locations of the AEDs in our schools. ELC has one across from the community room. Clark Mills has one outside the main office and one by the cafetorium. Pinebrook has one outside the nurse's office as well as outside the cafetorium. Milford Brook has the AED located near the main office and one near the gym. Taylor Mills School has one AED outside the nurse's office. Wemrock Brook has one outside the media center and another one outside the gym. Lafayette Mills has one outside the gym. MEMS has two outside the athletic director's room, one portable, one stationary, another one outside the gym, and also on the second floor outside the faculty lounge.
Sudden cardiac arrest is a leading cause of death. It can happen anywhere, to anyone, at any time. I'm here to demonstrate how to use the Philips HeartStart On-Site Automated External Defibrillator, or AED, in case you need to help someone in cardiac arrest. Set the AED on the same side of the patient as you. Press the On button.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
You have already called 911, so remove the clothing from the patient's chest as quickly as possible.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
These are the electrode pads.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Press pads firmly to patient's bare skin.
It doesn't matter which pad you put on first. The important thing is you place the pads exactly as shown in the picture and you press down firmly. As soon as the pads are in place, the AED will immediately start to evaluate the heart rhythm.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient.
Make sure no one is touching the patient.
Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Provide chest compressions and rescue breaths according to your training. Continue CPR until the AED tells you to stop, emergency medical personnel arrive, or the person starts moving. While you perform CPR, the AED will interrupt you at regular intervals so it can check if another shock is necessary.
Stop CPR. No one should touch the patient. Analyzing.
Keep standing clear of patient while the AED is evaluating the patient. It may decide to shock again, or it may say,
Shock not advised. It is safe to touch the patient. If needed, begin CPR.
even if they start to move or breathe normally, do not take the pads off the patient. The AED will keep monitoring the patient and will tell you if another shock is needed. That's it. Just do what the AED tells you from the moment you turn it on. When the emergency medical team arrives, you may have saved critical time by starting treatment. Even better, you may have saved a life.
Asthma. Asthma is a disease that affects the lungs. It causes repeated episodes of wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. Asthma accounts for a high degree of absenteeism from school. Asthma can be triggered by allergens and irritants. Controlling exposure of these triggers can reduce asthma episodes. Respiratory allergens and irritants include animals with fur or feathers, mold, dust mites, for example in carpets and upholstery, cockroaches, and strong odors or fumes from such products as pesticides, paint, perfumes, and cleaning chemicals.
Students may carry and self-medicate with their personally prescribed emergency inhaler, aka puffer, as long as they have a self-administration order. These medications are usually albuterol, Ventolin, or Proventil. 2 puffs from an inhaler in 4 hours is a normal dose. If you see a student using their inhaler more frequently, please report it to the school nurse. If you see a student using 1 to 2 puffs from their inhalers prior to exercise, it is not necessary for them to report to the school nurse. This is part of their individualized treatment plan to prevent an asthma episode. Refer to the student's individual health plan.
Coaches. If the athlete does not have his or her own inhaler, they are not permitted to practice or play.
Epilepsy. That was horrible.
First aid for seizures. Contact the nurse main office immediately. Observe the type and time of the seizure. Position the student on his or her side to prevent blockage of the airway from tongue, saliva, or vomit. Never put anything in the student's mouth. Protect the student from getting hurt. Remove harmful objects from the student's pathway or gently coax away from them. Use a soft, calm voice when talking to the student.
First aid for seizures. Protect the student from embarrassment. If the seizure lasts for 5 minutes or more, call 911. If the seizure is less than 5 minutes, but the student appears to be having one right after another, call 911. If a seizure occurs for the first time, in other words, the student does not have a medical history of seizures, call 911. If the student is a diabetic and having a seizure, call 911.
Diabetes. Type 1 diabetes is usually diagnosed in children and young adults and was previously known as juvenile diabetes. In type 1 diabetes, the body does not produce insulin. Type 2 diabetes is the most common form of diabetes, and either the body does not produce enough insulin or the cells ignore the insulin. The student who does not produce insulin needs to be given an insulin injection, either by drawing up a dose in a syringe, giving a pre-filled insulin pen dose, or entering a dose given through an insulin pump. It looks like a pager, so don't take it away. They're not text messaging. The nurse will administer to those who are not self-medicating. Refer to the student's individual health plan for the treatment of diabetes.
Hypoglycemia, otherwise known as low blood sugar. These are some signs and symptoms that your student may exhibit. If you see any of these symptoms, please notify the nurse. Hunger, sleepiness, shakiness, change in behavior, weakness, sweating, paleness, anxiety, blurry vision, dilated pupils, increased heart rate or palpitations.
Moderate to severe symptoms of hypoglycemia or low blood sugar: yawning, irritability or frustration, extreme tiredness, confusion, restlessness, dazed appearance. Report these symptoms to the nurse immediately.
What to do if your students show symptoms of hypoglycemia or low blood sugar. If symptoms of low blood sugar occur, follow the student's individualized health care plan. Give snack or juice as per the emergency plan. Notify the nurse and send student to the nurse with a buddy to check his or her blood sugar. If student is unconscious, immediately call 911 and notify the nurse and main office.
During a severe low blood sugar event, be sure that staff members who have regular contact with the student know where the medication is stored. The glucagon kit contains a vial with powder and a syringe with liquid diluent. Be sure to check the expiration date on the medication package. Remember to keep healthcare information confidential. Procedure for medication administration. Identify that symptoms of a severe low blood sugar reaction are present, and that based on the child's diabetes emergency plan, medication needs to be given. Call for assistance. Ask that another school staff person call 911 or emergency medical services. Explain the procedure to the child at his or her level of understanding. Assemble supplies and place on a clean surface. Review the student's diabetes emergency action plan. Check the glucagon kit and order to be sure it is for the right child, the right medication, the right dose, being given at the right time, and being given by the right route. Also check to ensure the medication is not expired. Wash your hands if possible. Put on gloves. Remove the glucagon vial and syringe containing the liquid or diluents from the case. Remove the gray cap from the vial. Remove the cap from the syringe. Place the needle tip in the center top of the vial and slowly push the diluent from the syringe into the vial. Gently swirl the vial with the syringe still in the vial until the solution is clear. This takes about 10 to 15 seconds. Turn the vial upside down, being sure that the needle does not fall out of the vial. Pull the solution into the syringe by pulling back on the plunger as you withdraw the ordered amount of glucagon solution. If present, remove air bubbles by tapping on the outside of the syringe and expelling the air, or by pushing the dose back into the vial and pulling back on the plunger again. Recheck the 5 rights again, checking the glucagon kit and order to be sure it is for the right child, the right medication, the right dose, being given at the right time, and being given by the right route. Identify the location, buttock, thigh, or arm for the injection. Cleanse the injection site with an alcohol wipe. Insert the needle into the skin at a 90-degree angle. Slowly inject the solution. Remove syringe. Put the used syringe in the carrying case. Close the carrying case to avoid a possible needle stick injury. Apply pressure using the alcohol wipe and gently massage injection site. If the student is not lying on their side,
Move the student to a side lying position, because vomiting often follows the injection of glucagon. If needed, ask another person for assistance. If alone with student and you have not already called 911 or emergency medical service, do so now. Monitor the student's arousal, pulse, and respirations. If breathing stops, begin rescue breaths. If breathing and heartbeat stop, begin CPR. Maintain a side-lying position to prevent aspiration due to vomiting. Once rescue squad arrives, inform them of medication administered, including type of medication, dose, and time. Send a long glucagon kit along with used dose. Dispose of all used materials in proper receptacles. Remove gloves and wash hands. Follow up with the parent or guardian and healthcare provider as needed. Document the event and administration of glucagon, including time, date, dosage, and site of administration.
Life-threatening allergic reactions. A person can have a severe allergic reaction resulting in death. Common allergens include, but are not limited to, bees, wasps, food like peanuts, soy, tree nuts, milk, and items containing latex. The student is to avoid the allergen. During celebrations, know what your student is allergic to. Avoid latex balloons. Signs of an allergic reaction include mouth and face. Symptoms would be itching, swelling of lips, tongue, or mouth, swelling of face and areas around eyes. Throat. Itching and/or a sense of tightness in the throat, hoarseness, hacking, cough. The skin could exhibit hives, itching rash, and/or swelling about the face or extremities, cold and clammy skin. Gut. Nausea, abdominal cramps, vomiting, and/or diarrhea. The lungs could show shortness of breath, repetitive coughing, and/or wheezing. Heart. Thread-like or weak pulse, passing out. The severity of symptoms can quickly change.
Anaphylaxis, the treatment for life-threatening allergies. If the student is trained to do so, do not hesitate to have the student administer their own EpiPen and call 911. If you are trained as a delegate, you can administer the epinephrine. See nurse for training specific to each student. We need volunteers, especially for after-school programs, field trips, etc. Directions. Pull off the gray safety cap, place black tip on the outer thigh, push EpiPen against thigh until unit activates. You will hear and feel a click. Hold in place several seconds, count to 10. Massage injection site for 10 seconds. Discard unit in a safe container until it can be placed in a sharps container.
In this video, I'm going to teach you how to administer an EpiPen if someone is having a severe allergic reaction. To administer the EpiPen, first get the prescribed EpiPen. Then remove the safety cap and follow instructions printed on the pen. Hold the EpiPen in your fist without touching either end. Then push the side with the needle hard against the side of the person's thigh, through clothing or bare skin. Hold the EpiPen in place for 10 seconds. Remove the EpiPen by pulling it straight out. Rub the injection site for about 15 seconds. Make sure to note the time of the injection and dispose of the EpiPen in a sharps container. An EpiPen should work within 15 seconds to a few minutes. Be prepared to give a second dose if the first dose is not sufficient. Now that you've administered your EpiPen, you should call for emergency help.
After EpiPen administration, did you call 911? Remember, in the classroom, you need to dial 91, then 911. Always call even if the student is better. Notify parent. Student must be transported to the hospital. coaches, after-school clubs. Students must provide a spare epinephrine in the first aid kit. It must go with the student to all practices, games, and activities.
These are some websites that was used to present our presentation. If you have any further questions or concerns, please don't hesitate to see your school nurse. This PowerPoint presentation will be available on Google throughout the year for further viewing. Thank you for your time, and we hope this presentation was helpful.